Hi, I'm Morgan Deegan from Physio and Fitness Clinic in Seaford. Today I wanted to talk to you about an injury that myself and the team here at Physio and Fitness Clinic pride ourselves on treating very well, and that is upper, or proximal as it's often called, hamstring tendinopathy. People with this injury will often complain of deep posterior, which is the back, upper hamstring or lower buttocks pain. They will also often have pain when they're accelerating or decelerating whilst running, and find these tasks more difficult to do than previously. The main symptom though of this injury is that they experience pain whilst they're sitting. Our hamstrings are made of 3 different muscles. These muscles are the semimembranosus, the semitendinosus and the biceps femoris. These 3 muscles attach to the ischial-tuberosity of the pelvis, which is at the back here. These tendons can be prone to injury, particularly as they can be on stretch as we move into hip flexion. So as you can see, as we move into hip flexion, there will be more of a stretch in through as these tendons attach. So when we're sitting down, we've got the stretched tendons and we're also sitting on the ischial tuberosities, which means that we can experience some compression in through those tendons. And that's why there's a higher rate of tendon injury to the proximal hamstrings than for some other tendons. The risk factors for this type of injury include being a middle or long distance runner, being of increased age, and that's actually only referring to anyone who's really over about 30 years of age. And also having a history of kicking sports as a youngster. And also people who lack flexibility through the hamstrings, glutes and back, because this can put more strain in through the tendons than would otherwise occur. Chronic proximal tendinopathy is an injury that can be very difficult to treat. Part of the reason why it can be so difficult to treat is because many people will have the symptoms for many months before they get advice. Therefore, time is of the essence. So if you start to feel symptoms in that area, particularly if it's worse with sitting, then you really should be assessed and treated by a physio quite quickly to avoid it becoming chronic.